Today we're meeting with Dr. Trey Alexander, orthopedic surgeon here at Florida Medical Clinic. Dr. Alexander specializes in hip and knee replacement for arthritis, as well as revision and treatment of painful or failed hip and knee replacements. Why would someone need a joint replacement?
Well, it's an elective procedure. I mean, it's the primary treatment for arthritis, but it's also the last treatment. We do everything we can to prevent surgery. We do things like Advil, Motrin, any of your over-the-counter anti-inflammatories. And when that doesn't work, we have prescription anti-inflammatories. We have cortisone injections. Some people may have heard of lubricant injections. And we try all of those things until nothing works. And then it becomes a quality of life issue. We want to keep people moving. We want people to enjoy, their time. We want people to go on trips and be active. And so when all the conservative treatment fails, that's when we do hip and knee replacement surgery.
You talked about replacements with fillers or with needles and shots. What are you putting in now as compared to what you've put in the past? What is the latest and greatest in your field that you're using?
So currently, the injections are more just kind of temporizing procedures. They help with the inflammation. They help to control the symptoms, but nothing stops the arthritis. Okay. The only thing that actually stops your arthritis and the so-called cure for arthritis would be the hip and knee replacement surgery.
Okay. And when you replace them, are they metal? What are they made of?
So they're made of primarily titanium. We use some ceramic products, and there's always one portion of the implants that's actually polyethylene, which is very high industry plastic, I guess, so to speak.
But there's no way to prevent someone from having a hip or knee replacement, is there?
There's not. I guess you could stop having birthdays, but it's really not a good choice. So it's arthritis. If we live long enough, we all get it, and so it's just a matter of quality of life and controlling our symptoms, controlling pain.
Okay. So after a surgery, how long is the recovery process?
So after a hip or knee replacement surgery, patients are up and walking that same day. Patients go home as early as the very next day after surgery. Sometimes they might stay 2 or 3 days, depending on maybe other medical issues that's going on. But really, after they get through that first night, the decision on going home really becomes a pain control decision. And as long as the patient's comfortable and they can move around okay, they're okay to go home.
I've heard of endoscopy. What is arthroscopy?
So arthroscopy is a type of endoscopy that's specific to joints. It's a common way that we do sports medicine type of surgeries, whether it's the shoulder or the knee. It's through small incisions. We use a video camera and small microscopic instruments to do less invasive surgeries. They tend to be outpatient surgeries. Patients can come in and go home the same day.
Healing time is much quicker, I'm sure.
Much quicker.
Do you deal with a lot of patients, sports athletes as patients?
I do. I do take care of sports injuries. Here in the practice, we're involved with some of the local high school sports teams. But yeah, we do take care of sports medicine patients as well.
You look young. How many surgeries have you done?
Last year alone, I did approximately 600 hip and knee replacements, and probably about 40% of those were redo or revision surgeries of ones that have failed or possibly done incorrectly.
Why would somebody hesitate to have their hip replaced? Is it simply, I may not be able to go through the surgery, I'm too old, or is there a reason why somebody would say, no way, that's not for me?
There are risks, just like with any surgery. I think a lot of it is the unknown. Whether, decisions to prolong the surgery is kind of multifactorial. Sometimes, it's life issues that are people going on. They might not have the family support around that they need. It might be a medical complication such as a cardiac condition that they may have. But I could tell you that people that do put it off, the majority of them, once they have it done, they wish they did it 5 or 10 years ago.
Is that right?
Yeah.
And recovery time, that probably varies per person?
Like I said, people are up and walking the very next day. At first everybody uses a walker for the most part, but as soon as they can transition from a walker to a cane, they're allowed. Most patients, that's 1 or 2 weeks. And at the end of 3 to 4 weeks, most patients are getting around without the use of any ambulatory aid.
Florida Medical Clinic has an all-star team of physicians in the Department of Orthopedic Surgery, and they're all trained to care for athletes of all levels. But as you just saw, that is not all. call Florida Medical Clinic to make your appointment. Or, for even more information, go to floridamedicalclinic.com.